Thank you, sir. Dr. Parvati, you are online? Dr. Parvati? Dr. Parvati?
Hello, yes, sir. Can you hear me, sir?
Yes, yes. So, are you ready?
Yes, sir.
Okay. Good evening. I'm Dr. Surya Prakash Vankina, consultant radiation oncologist, Mahatma Gandhi Cancer Hospital, Visakhapatnam. So, in today's the second session, we'll have a discussion on RT instruments for Osce for the DNB practical. So, coming to Dr. Parvati, am I audible?
Yes, sir.
Yeah. So, coming to the first question. So, identify the instruments or objects in the image and then explain the role in radiotherapy.
Sir, the image is that of a lead shielding block. It is commonly used to protect normal tissues from radiation exposure, such that they are placed in the path of the radiation beam to shape the treatment field and shield the organs at risk, sir.
Okay. Other than lead, what other shielding blocks are used in radiotherapy?
So this is lead shielding blocks, sir. Other than lead, we can use custom blocks made out of Cerrobend, sir. Because lead, the melting point of lead is 325 degrees Celsius. So it's difficult to mold them into custom blocks. So we add other metals to lead and make an alloy so as to bring the melting point lesser temperature so that we can mold them and make custom blocks out of them, sir.
Okay. So we'll coming to the next question. What is Cerrobend? Discuss its composition and why. I think you already answered this. Why it's preferred over lead in radiotherapy for making blocks?
Cerrobend is a low melting point alloy of lead. It's made up of bismuth, tin, lead, and cadmium. The percentages are 50% of bismuth, 26% of lead, 13.3% of tin, and 10% cadmium. And this is used in radiotherapy because it's easier to mold and shape Cerrobend into custom blocks. And also the lower melting point, which is 70 degrees Celsius, allows in-clinic preparation of the custom blocks. And this is also less brittle than lead, so it's safer to handle.
Okay. When you're making a block, let's say there are two kinds of blocks. Let's say photon blocks and electron blocks. Okay.
Yes,
So
sir.
what will be the thickness of a like approximate thickness, or how do you quantify the thickness of Cerrobend block when you're using it for blocking photon beam?
To block, what we look for is the half value layer, sir. Half value layer is defined as the thickness of lead that is required to attenuate the primary beam to 50% of the present value. So for lead and for 6 MV photons, it's almost 4.32 half value layers are required to attenuate the beam and bring it to less than 5%, sir.
Okay. So what are the issues or problems with Cerrobend? What are the other names of Cerrobend and what are the issues with it?
Cerrobend is also called Lipowitz metal or Woods metal. Woods is named after the person who invented this. That's why it's called Woods metal. The main issue is, sir, the cadmium. Cadmium, when we are molding it, it can release toxic fumes that are poisonous. So there are Cerrobend alloys which are devoid of cadmium. So instead of cadmium, the percentage of lead will be more, and that is called alloy 203. Here the bismuth will be 50% itself, but tin will be 18.8% and lead will be 31.2%.
Okay. So coming to the next question. So identify the device and mention its use in radiotherapy.
So this is a flattening filter. Flattening filter is used in radiotherapy so as to bring the forward peak beams to become a homogeneous distribution. And the beam that has now become homogeneous is called hardening of beam. This increases the quality of the radiation beams.
So where is this located in the linear accelerator or the teletherapy machine?
It's located between the target and the jaws in the LINAC head, sir.
Okay. So is it used for both photon and electron beams and or only for photon beams?
Only for photons, sir. Sir, the electron beams are pencil beams and we make them homogeneous by passing them through a scattering foil. And that's already homogeneous, so we don't need a flattening filter to get a homogeneous therapeutic beam. But in photons, the center beams will be of more energy. So to get a homogeneous distribution across the treatment field, we use flattening filter for photons.
So why is this shaped like a cone? Okay.
The shape is conical so that more of the central beams are absorbed and the peripheral photons are balanced so that the fluence that comes across is homogeneous.
Okay. So coming to the next question. So identify the equipment or device
Thermoplastic cell.
and its purpose in radiotherapy.
So this is a thermoplastic mask. It's used in radiotherapy to have a reproducible immobilization of the patient, minimize the movement, and ensure accurate delivery of radiation.
Okay. So what are okay? You already spoken about the advantages. So in the picture, what type of thermoplastic mask is?
So this seems to be a polymethyl methacrylate, sir, acrylic, PMMA.
Not about the material. Like say you're giving in simulation order. So you
Three clamp head mask, sir.
okay, 3 clamp head mask. So what?
Uh,
Or sometimes it is called in some institutes they call it the brain mask or the 3 clamp head mask.
yes, sir, brain mask, sir.
Brain mask or head mask. That's fine.
Mm.
So what are the masks you know about?
Sir?
What are the masks? Can you describe?
Okay, so brain mask is usually used for whole brain radiotherapy or conventional radiotherapy of brain, say 4 GBM, 60 gray and 30 fractions. Like conventional radiation, we use a brain mask. Then there is a 5 clamp head and neck mask for head and neck cases, such as oropharynx, larynx, nasopharynx. Then there is 2 clamp breast mask for CA breast. There is 4 clamp chest abdomen mask for CA lung, CA esophagus, and there is pelvic cast for CA cervix, CA rectum, CA prostate for all the pelvic malignancies.
Okay. So coming to the next question. So identify the immobilization aid seen in the image and its role in radiotherapy.
So this is a headrest. It's used to stabilize the head and neck and support proper alignment and ensure patient comfort and reproducibility.
Okay. So identify this device.
Breastbone.
So this is a breastboard with wing board and arm support.
Okay.
The components are adjustable base plate, arm supports, T-bar or wing board, headrest or head cradle, indexing system, and there can be lateral wedges or elevation blocks.
Okay. So when do you use? What is the benefit of using this device or flat
Uh,
coach?
Breastboard is usually used in CA breasts so as to align the chest wall parallel to the beam, reduce the heart and lung dose, and ensure reproducibility and patient comfort.
Okay. So let's say, can you think of a palliative setting where this can be used? Dr. Parvati.
So if patient is not able to lie flat, um,
That's what possible scenarios most common where they're not able to lie flat. So
so superior vena cava obstruction.
Exactly. So in supraventricular obstruction, this can be brought to use. In some,
Lying down will increase the difficulty, and so.
a few hospitals, very few hospitals have something called that SVCO chair, where patient will be in a sitting position and they'll plan 2D radiotherapy. But the breastboard can be used to give that angulation for patient's comfort. So you talked about breast radiotherapy, the mobilization device, breastboard, and so which along with which radiotherapy techniques is this used, or with other techniques this is not required?
Sir, I did not understand, sir.
So will you use breastboard with when you're planning VMAT radiation planning, VMAT or IMRT?
No, sir. That will also decrease heart and lung dose. So.
No, that's not exactly that. So in 3D or 2D, you're trying to make the chest wall parallel to the beam. You have
Yes, sir.
tangents.
Yes, sir.
Whereas in VMAT and all, you don't have your tangent. It's an arc.
Yes, sir.
The sloping of the chest wall wouldn't matter much then. Okay.
Okay, sir. Okay, sir.
So at that, in that you can keep the patient supine and with the Vac-lock or with the thermoplastic immobilization, you can do that. So that's
Okay, sir.
coming to the next question. Identify the device.
So this is a Vac-lock bag, which is a vacuum immobilization device used to mold and support the patient's body in a reproducible position for simulation and treatment.
Okay. So which sites this is ideal or most commonly used?
Mm.
Which cancers?
So pelvic cases, extremities.
Yeah, pelvic, extremities, or even thoracic, and like I said, breast immobilization when you're not planning, means you're using a VMAT or IMRT technique.
SBRT.
Yeah,
Yes, sir.
SBRT, yes. What are the advantages when compared to thermoplastic immobilization?
The advantages is that it's customizable and stable positioning, and it's good for non-flat surfaces or non-supine positions, and it improves the reproducibility and patient comfort.
Yeah. I think except for head and neck, most of the sites this is good. Even for craniospinal, you couple it with a head mold. A Vac-lock has immense benefit. Okay, identify
Yes, sir.
what is the purpose. Mention the purpose.
So this is a compression plate or compression belt, which is applied over the abdomen, and the use is to restrict the diaphragm movement, thereby reducing the tumor motion.
Okay. So where is this used? Which malignancies or what's the purpose?
Sir, it's used in malignancies such as cancers that involves the basal lobes of lung, so that the diaphragm movements can cause a lot of motion of the tumor. So we will have to give increased ITV that will increase the area receiving more dose. Also in liver tumors, liver moves with respiration, so that will also cause increased tumor motion.
Yeah, liver.
So
It's like for mostly for SBRT.
yes, sir. So
SBRT.
in SBRTs, we need to give tighter margins. So abdominal compression, and thereby we can answer.
Okay. So next question. Identify the image and discuss the physics principle and common clinical indications and the materials used.
So this is a bolus, sir, which is a tissue equivalent material which is placed on the skin surface to eliminate the skin sparing effect and bring the dose closer to the skin. The most three common indications are post-mastectomy, chest wall irradiation, skin involved or cutaneous metastasis, or to boost scar or surgical flap regions. Materials most commonly used are super flap, paraffin wax, wet gauze, thermoplastic gel, or 3D printed bolus.
Okay. So coming to the next question, identify the image and what are the indications where this device or is used, and how does this differ from a bolus?
So this is a tissue compensator. Tissue compensator is a beam modifying device that achieves a uniform distribution across the target, which has an irregular surface or varying tissue thickness. So this compensates for missing tissue or contour irregularities so that the dose prescribed is delivered evenly. Tissue compensators are mostly used in head and neck cancers because when we come to the neck portion, there is irregular contours, there is loss of tissue when compared to the head. So this inhomogeneity can be corrected with a tissue compensator. In post-mastectomy chest wall irradiation also, there will be tissue irregularity, and in parotid and oral cavity tumors, in total radiation also, we need to have homogeneous dose across the body. So this helps to reduce hot spots and cold spots by giving a homogeneous distribution all throughout. And
Okay.
how is it different from bolus? Bolus is a tissue equivalent material that we keep on the skin so that the Dmax will shift towards the skin and skin surface will be evenly covered. On the other hand, compensator is a beam modifying device. So it modifies the beam even before it enters the body and shapes the isodose curve as we want to do that.
Okay. So identify the device and its purpose in radiotherapy.
So A is an electron applicator which will be placed on the treatment head to collimate and direct the electron beam towards the patient. And B is an electron cutout. Electron cutout are kept along the pathway of beam.
Okay. Dr. Parvati? Am I audible?
Yes, sir.
Yeah. So why is this electron cutout kept in the path of the beam?
So electron the electron beam that comes through the electron applicator needs to be custom shaped into the clinical target that we want. So to shape the electron beam, we keep custom cutouts which are made of lead or Cerrobend and keep it in the beam pathway so that we can mold the treatment field as we require.
Okay. So identify the device. No. Very
So uh, this is a beam spoiler. Beam spoiler is a low density material which is usually acrylic or lucite, and it is placed in the path of a high energy photon beam to increase the surface dose. Its indications are mostly total body irradiation where we need more surface dose. So the high energy photon beams usually have a Dmax much deeper. 6 MV Linacs have 1.5 centimeter Dmax. So to move the dose closer to the skin, we keep the beam spoiler about 10-20 centimeter in front of the patient. So this will give out secondary electrons that will give us a homogeneous dose distribution along the skin.
okay. Identify the device.
This device is a testicular shield, which is a two-piece hemispherical shield that encloses the scrotum. So this will give 360-degree coverage of the testis, and that allows easy placement and removal, and also reduces the scatter dose to the testis and preserve fertility and endocrine function.
Oh, okay. Which all clinical scenarios you can think of using a testicular sheet?
Sir, in pelvic irradiation, if a male who is yet to complete his family has a CA rectum and undergoes radiotherapy, then we can use a testicular shield.
So how common is that? When did you last time use a testicular shield for a CA rectum patient?
I have seen just once. And then in CSI also, if we are giving.
So younger patients, rectum you don't usually patients, so CSI probably. But you say again, you can say lymphomas.
Yes, sir.
Okay. So identify the device and indications.
So this is an eye shield. Eye shield is used to protect the lungs, retina, and cornea from radiation exposure. Its indications are periorbital skin cancers, eyelid tumors, conjunctival lymphomas, and orbital tumors.
So what is it made of?
So
Material.
it's made of lead, but it will have a plastic coating so as to not cause any abrasion over the cornea.
Okay. Coming to the earlier question, what is the testicular shield made of material?
That is also made of lead only, sir.
Yeah. So eye shields, what you are seeing here in the picture, are actually made of tungsten. So, but they can be made from lead. Means earlier they were made of lead, but commercially available shields are made of tungsten.
Okay, sir.
So identify the image and what's the primary function in a linear accelerator.
So this is a multi-leaf collimator. It is a beam shaping device in a linac and is composed of multiple individual tungsten leaves that can move independently to conform the radiation beam to the shape of the tumor. The primary function is to provide dynamic and precise beam shaping, allowing for conformal treatment in IMRT and VMAT. So the highly conformal dose distribution is better when compared to the it better matches the 3D shape of the tumor and reduces the OR doses.
Okay, yeah. Just remember this. Multi-leaf colorimeter is one of the greatest advances of modern radiotherapy. Without this, we couldn't do possibly most of what we are able to do today. Other than
Yes.
image guidance and all, apart from image guidance, multi-leaf colorimeter is one of the greatest advances in modern radiotherapy.
Yes,
Okay.
sir.
So identify the image. Dr. Parvati?
Sir, can you hear me, sir?
Yeah, you're audible. Yes. So identify the image and what is you use in the two-dimensional or three-dimensional radiotherapy, or whether it's necessary or used in like intensity modulated or volumetric arc therapy. Yeah.
So this is a wedge filter. Wedge filter is a beam modifying device that when kept in the path of a beam modifies the isodose curves. That is, it tilts the isodose curve toward the uh, specific side. So the wedge basically has a heel and a tip. So when we are keeping the edge in the path of the beam, the rays that is passing through the heel will get attenuated and the isodose curve shifts towards the opposite side. So this improves the dose homogeneity across sloping or irregular surface such as breast, and it compensates for tissue thickness variation. So depending on the angle, there are different types of wedge: 15-degree, 30-degree, 60-degree. 60-degree is also called the dynamic wedge, and it's usually built in the linac. So these days in modern IMRT and VMAT, we don't use wedges. We use the MLC jaw movement during beam delivery to simulate the wedge effect without inserting a wedge in the path of the beam.
Okay. Just recheck means across variant and across the vendors, there's a difference elements and there's a dynamic wedge, there's a motorized wedge. So
Yes, sir.
okay, and there's something called universal wedge. Okay.
Yes, sir. Universal wedge is the 60-degree wedge, sir.
I believe it's different from vendors, but recheck it.
Okay, sir.
And coming to this, so when is a wedge used as a wedge, and when is it used as a tissue compensator? So clinical scenarios where is actually used as a tissue compensator.
Sir, in head and neck cases, the neck will have less tissue. So there we can keep the heel of the wedge so that the beam will get attenuated and we will not have any hot spots on the neck, sir.
Yeah, it's more not as customized as tissue compensator, but it will serve the purpose.
Yes, sir.
Even in earlier when you said parotid or
Single larynx, sir.
larynx, breast. So this is mostly used as a tissue compensator. And
Yes, sir.
so identify the device and role in radiotherapy.
So this is a scattering foil, which is a thin sheet of metal made of tungsten or aluminium. So this is usually in the linac head. The electron beam that is produced will be a pencil beam. So we need to get a homogeneous beam across the treatment field. So we'll keep the scattering foil in the pathway of the electron beam, and that will produce a homogeneous electron beam radiation for the treatment.
Okay.
So the primary function is this, it will give a more uniform and broader treatment field.
Okay. So identify this.
So this is a SRS cone, stereotactic radiosurgery cone. This provides small circular fields for high precision radiation targeting in SRS. So in gamma knife and all, there are 4 mm to 25 mm circular cones through which the radiation beam passes, and we can collimate as per our requirement of the target, sir.
Okay. Identify the device.
So this is a T-rod. T-rod is an emergency safety device which is mainly used in cobalt teletherapy units. So if the source is stuck in on position, we will use the T-rod to move the source from on position to off position in emergency situations.
Yeah. Right. So identify the device and its use and key features.
This is a Lexel G frame, which is a rigid invasive stereotactic frame. It is used in gamma knife SRS. The main features are it provides stereotactic coordinate reference, and it fixed with 4 skull pins and is used for single session. Because this is invasive, we are fixing it in the skull, so it's used for single session cranial SRS only. It is compatible with MRI and CT and angiography. So with the mask frame on, we can do the MRI and then fuse and then treat in a single sitting, sir.
Okay. Identify the device.
So this is a Cosman Roberts Wells frame, which is again a rigid stereotactic frame. This is also used for SRS and frame-based Linac SRS neurosurgery. The key features include a circular ring frame with coordinate arc and high precision for deep-seated lesion.
Okay. Identify the instrument.
So this is a farmer chamber. Farmer chamber is a thimble type ionization chamber. These are used for high precision dose measurements in external beam radiotherapy.
So yeah,
Uh,
that's part of your weekly QA.
yes, sir. So it measures the charge which is collected from the ionization events in the sensitive air volume.
Yeah. So identify the device and its use in radiotherapy.
So this is a parallel plate ionization chamber. It's used to know the absolute dosimetry and depth dose measurements in electron beam therapy, especially for superficial depths. It's also used for surface dose and depth dose measurement in the build-up region of photon beam.
Okay, right. So identify this instrument or equipment and its purpose in radiation oncology.
So this is a radiation field analyzer, which is again a part of the quality checks. So this measures the beam profiles, the percentage depth, dose, and output factors of a LINAC commissioning, and for quality assessment. This also uses ionization ion chambers and diodes to measure dose at different depths and position in water. Water is mainly used because that is equivalent to the human tissues. So in this also we use water, and in the water we check at different depths what is the dose and measure that and do the commissioning and QA checks.
Okay. So identify this equipment and any clinical setting where it's routinely used.
QTPI, this is a ionization chamber QTPI or survey meter. It is used to monitor radiation leakage around LINACs or HDR brachytherapy after loaders.
Okay. Identify this device and what type of radiation measure or detect.
So this is a Gigamuller counter. Gigamuller counter is good qualitative assessment of radiation such as alpha, beta, and gamma. So in case where we have to check for radiation, first we will use GM counters because that will tell us qualitatively where is the radiation leak. And if we want to quantify that, then we can use the QTPI survey meter, and that will quantify how much of radiation exposure is there in that particular area.
Okay. So identify this equipment and mention what type of radiation does it detect and where is it commonly used.
So this is a neutron REM counter survey meter. So this helps us to detect neutrons, especially fast and thermal neutrons. So this will be used in radiotherapy setup where there is neutron production, such as in proton beam therapy or in LINACs where we are using high energy, more than 10 MV. In these cases, there will be neutron production. So we will use neutron run counter in these settings, and also in brachytherapy with neutron emitting sources.
So what are the neutron emitting sources in brachytherapy?
Uh, I don't know, sir.
Yeah, so I think Californium 252, but be careful, don't mention anything in exam which you can't follow up. Okay.
Okay, sir.
So next question, identify the instrument and mention its primary function in a radiation facility.
So this is an alpha radiation survey meter. So this detects and measures the alpha particle contamination on surfaces or equipment. And this is used in nuclear medicine, brachytherapy, isotope handling, and this also helps as a radiation safety monitor.
Okay. So I think there are series of physics related which are not commonly seen, but we will go. So identify this instrument and clinical uses in a radiotherapy department.
So this is a dose rate meter. It's used in radiotherapy department to detect the leakage and stray radiation in and around the LINAC and cobalt units. And also in brachytherapy units during source loading and unloading, and also to know the integrity of walls or doors and control consoles.
Okay. Just discuss with your physicist everyone difference between this one and the survey meter. I am not very sure. Just check what's the difference between the QTPI and this dose rate meter. Okay.
Okay, sir. Okay, sir.
Next question. Yeah. What identify this device and primary function in radiotherapy and what?
So this is a 2D array detector. Its function is to measure the planar dose distribution for quality assessment of IMRT and VMAT. And the QA is used is patient-specific pre-treatment QA.
Okay. So identify the device and primary function and what treatment modality it is most commonly used.
So this is a well-type ionization chamber. It measures the source strength of sealed radioactive sources, and treatment modality commonly used it is in brachytherapy.
Okay. So identify this device and its use.
So this is a Las Vegas Phantom. It's used to assess the image quality and performance of CT and PET-CT scanners. So it assesses the image resolution, contrast, and uniformity of the CT simulator.
Okay. So identify this device and mention its use.
This is also a phantom, sir. It's called CAT Phantom, computerized axial tomography phantom. That is also for the quality assurance of CT simulators to see the image quality and assess them.
Okay, going to the next question. So identify the equipment or device.
This is an extrapolation chamber, sir. It is used to accurately measure the dose in superficial layers, that is surface or built-up region, and to know the absolute dosimetry of low energy photon and electron beams for calibration procedures.
Okay. So coming to the last question. So identify this device and its use.
So this is an electrometer. Electrometer is also based on ionization chambers. So this will detect the radiation dose. How? By it measures the electrical charge or current that is produced by the ionizing radiation, and then this charge is collected and converted into a digital reading, and that reading will correspond to the radiation dose that was exposed.
So thank you, Dr. Parvati. We have come to the end of the session. Now I call Patra sir to conclude the session.
Thank you, sir.
Yeah. Okay. So okay. The session has concluded for today. So we'll again meet tomorrow at 7 p.m.
Thank you, sir.
Okay.